As mentioned last week, my name is Dr. Zane Cohen, and I am a senior member of the surgical team at Mount Sinai Hospital. I am continuing to oversee the clinical care team for Mayor Rob Ford. Over the past few days, our focus has been on completing a comprehensive medical assessment of Mayor Ford. And we've been discussing our findings and recommendations directly with him and his family. Today, given the extensive public interest and with the permission of the mayor, I will provide a brief status update of our clinical assessment and proposed treatment plan as discussed with the mayor and his family. As a brief review, Mayor Ford was admitted to Mount Sinai Hospital last Thursday, September the 11th. Myself, together with a multidisciplinary team of specialists, then undertook a thorough medical assessment. This included, as you know from last week, a review of the CT scan from Humber Memorial Hospital and a CT scan of the chest that was done here, as well as a biopsy of the abdominal mass that I mentioned last week. That biopsy of the abdominal mass, the initial biopsy, did not yield us sufficient material to make a conclusive diagnosis. Most of the cells actually were dead, and that is not unexpected in a relatively large mass, because as it grows, it outstrips its own blood supply, and some of the cells die. So after further discussion, on Monday, a repeat biopsy was done of the mass. And that led us to a more conclusive diagnosis, which we discussed fully with the multidisciplinary team at a meeting on Monday evening, as well as, again, this morning. That led us to further discussion with the mayor and his family and formulate a treatment plan which we recommended to Rob Ford. The diagnosis is a malignant liposarcoma. A few things I would like to say about that tumor. It comprises about 1% only of all cancers. It has about 60 different cell types. It arises from sarcoma in general, arises from soft tissue structures. So it's not within an organ, it's not in the colon, it's not in the liver. It's in the tissues such as fatty tissue, blood vessels, nerves, connective tissue, muscle. It has 60 different cell types, and that's what makes it a very rare tumor and a very difficult tumor. However, we are optimistic about this tumor. The reason I say that is that we have experts sitting in-house that treat, manage, and research on sarcoma, one of the largest of the 3 sarcoma centers in Ontario. Not only experts in the clinical management, but experts on the research side of sarcoma as well. We then tried to discuss formulating a plan for Mayor Ford. The plan will be initially chemotherapy. This chemotherapy will involve in-hospital, inpatient chemotherapy for about 3 days, followed by a washout period of about 18 days. The cycle will then be repeated. The response will then be reassessed with imaging. Depending on the response, will depend on what we do next. May require further cycles of chemotherapy. There may or may not be radiation involved. There may or there may not be surgery involved. It will all depend on the response to the initial treatment and subsequent treatment as well. And so that is the report. I will take a few questions now. I would ask that, the same as I did last week, that no shouting, please. I will respond to as many questions as I can. Please raise your hand, and please tell us your affiliation before you ask your question. I think you were, just a minute, I think you were first back there.
Thank you. With the Global National. You said it was a malignant, what, could you explain the name of it again and exactly?
It is a liposarcoma, lipo meaning fat. So it comes from the fatty tissue. It arises out of the fatty tissue, but it is definitely a malignant tumor.
Dr. CityNews?
Yes.
Every patient, when they get the frightening diagnosis that they have cancer, will ask you, how bad is it? And am I going to die? And how much time do I have? Can you answer any of those frightening questions?
Well, I can say that we are optimistic about treatment. This particular liposarcoma is more sensitive to chemotherapy than most sarcomas. That is an optimistic statement in and of itself. We can't really say anything more because we'll be able to say more, I think, after the first round of the chemotherapeutic treatments. After the 2 weeks, as I mentioned, after the 2 cycles, not the 2 weeks, we will be re-imaging and reassessing exactly the response to the treatment.
Do you have a success rate in these sort of situations that you can use as a marker?
It is such a variable tumor and such a rare tumor that no, the answer is no, for that reason.
Doctor?
Yes, over here.
Have you performed
From?
With CP24,
Right.
Have you performed a biopsy on any other part of the mayor's body or any other organ?
Well, there's some confusion out there, I think, that we performed a biopsy of the chest, and we did not. There was nothing to biopsy in the chest.
Doctor,
Next. Yes, over here.
my name is Marie Babbage. I'm with the Canadian Press.
Yes.
Did the cancer spread to any other organs in the body?
Could you just repeat that again?
Did the cancer spread? Have you found cancer in any other organs in the body?
We have not found cancer in any or other organ of the body.
In any other part of the body, sir?
Yes, we have found a small nodule in the buttock behind the left hip.
What does that mean? Yeah, what do you mean?
We have biopsied that, and it is part of the same tumor.
So is this tumor?
Dr. Colin DeMello from CTV News. Is this something that could have been discovered earlier?
You know, I think that's really an impossible question to answer. We know that the mayor had a kidney stone a couple of years ago in 2011, I think it was, and he had a CT scan at that time, and apparently there was nothing there.
Doctor, it's James Murray with the CBC. You say that you may not perform surgery. Does that mean you're going to leave the mass in?
Not necessarily, depending on the response of treatment. It is sensitive to the chemotherapy. We'll see what happens to the mass. What if it completely disappears?
And what you're describing is the next month of his life. He's supposedly in an election campaign right now for a city council seat. Would you advise him not to do that? He has to do this.
No, I can't really advise him to do or not to do. I can't advise anybody now. I think it will depend on his response to the initial treatment.
The response to this is usually what? Like what chemicals and what?
Well, we're looking at fairly, I'm not going to name them, but we're looking at fairly intense chemotherapeutic agents that we hope will shrink the size of this tumor.
Can you say what
Just a, yes, yes.
Sorry, Natalie with the National Post. So just to be clear, you're saying then that the cancer has spread to one other place in his body?
Yes.
Doctor, will he be receiving his cancer treatment exclusively here at Mount Sinai, or will he be transferred in any capacity to?
He's going to receive his chemotherapy at Mount Sinai Hospital. Will be transferred to the care of one of our medical oncologists.
Doctor, can you say what stage this cancer is? We know there are various stages.
No, I can't say.
Can you say if it's an aggressive tumor?
Yes, I can say that we think it's a fairly aggressive tumor, mainly because these types of tumors are often slow-growing. They, to get to the size that it is now, it's often several years. We know that the CT scan in 2011 didn't show anything, so it's in the last 2 or 3 years. So it's fairly aggressive. But we are treating this very aggressively in order to eradicate the tumor.
Doctor, what are the chances that the mayor will make a full recovery?
Well, I think that's the same question that was asked over here, and I can't give you that right now. Yes.
Sean Jeffers, Toronto Sun. I'm wondering if you can talk a little bit about the period of hospitalization the mayor will be facing this year.
Yes, it will be really according to the cycle that I gave you. So there will be 3 days of chemotherapy. There will be probably an extra day in the hospital, and then he should be able to go out of the hospital for about 17 days and then come back in again for the next cycle.
Doctor, you say the cancer has spread. What are the chances now of it spreading further into other parts, and how do we either try to stem that from happening or try to monitor its progress to see if it does spread?
Right. Well, as I said already, we are going to continue to follow up, investigate, and image this so that every 2 cycles of the chemotherapy, which is really in 40 days' time, he will go through some of the same imaging studies that he went through now. That's how we will monitor not only the tumor itself, but the rest of the body.
CityNews again, how debilitating will his treatments be? Chemo impacts people differently depending on the type used.
Well, I think he's a pretty strong person. And the answer to your question is that it's variable. The chemotherapy affects different people in different ways, and it's impossible to predict how it's going to affect him. Of course, everyone knows that chemotherapy is chemotherapy, and he's going to have some tough days, but I think he'll have more good days than bad days.
And why wouldn't you operate first? Are you hoping to use the chemo to shrink the tumor before you assess if you're going to operate?
Yes.
Doctor?
Yes, down here.
Toronto Star. When was his family given this information about the cancer diagnosis?
In the last 72 hours.
Doctor, Adam Dabrowski with Global News. When will the chemotherapy regime start for the mayor?
Within the next 48 hours.
With CTV again, is there any way to tell how long this tumor, this mass, has been growing in his abdomen?
Not really, no, and I think that I've sort of answered that by saying it wasn't there in 2011. It's there now, so within a period of 3 years, it's there.
He was complaining of abdominal pains for the last 3 months.
Yes.
Is that a good timeline for it to grow to the size that you see it today?
No, I would think that it's been there before 3 months for sure. I think the pain is likely due to what I said previously, that the size of it now has outstripped its blood supply. So he has what's called necrotic tissue in the middle of the tumor mass. That I'm pretty sure is what's giving him his pain, and also the fact that it probably has grown as well during that period of time.
And how much does personal health play into this tumor itself?
There's no known association with sarcomas.
So,
Some people are able to work.
Sorry.
Stephen DeSouza from CBC. Forgive me if you've already answered this, but are there any other tumors in the mayor's body that will need to be treated, or is it just...
Not that we know of.
Sir, some people are able to work throughout cancer treatments. Would the mayor be able to, and would you recommend that?
Well, as I said before, I can't recommend yes or no. And he may be able to work through it. I think that he will be able to be functional. But he's going to have some rough days. I mean, that's just common sense.
Can you please give us the dimensions of the abdominal tumor and the other one that's in the butt?
The tumor is about 12 by 12 centimeters in size.
That's the abdominal one?
Yes.
And the other one?
It's much smaller. It's about 2 centimeters.
And that's the secondary tumor?
Yes.
And are either attached to anything? I think you may have answered this already.
No, it's not contiguous. It's not attached. Those two are not attached.
How are the mayor's spirits throughout? I mean, it's a difficult diagnosis for anyone. How is he reacting to all
I
this?
think he's reacting like any patient would react. It's difficult.
Dr. Cohen, Jennifer Baglio from the Toronto Star, down here.
Where are you? Oh, sorry that you have to be on the floor.
Sorry. My understanding is there's several different types of liposarcoma. Are you able to tell us which type this is?
Well, it's a liposarcoma. It's called a pleomorphic liposarcoma.
Do we have time for one more question? More questions? Yes, doctor. You said that they can't measure, it can't be measured when this primary tumor may have started growing. Now, the mayor has said in the past that he had another tumor removed from his appendix 2 years ago. if he's now developed another tumor which is malignant, how does that,
I think that's an important point, and I want to clarify that. He did not have a tumor of the appendix. We have documented evidence now that his time in Humber at 2009, it was for appendicitis. And the reason that he had to have part of his colon out is because the inflammation of the appendix extended down to the base of the appendix, which is in the area of the cecum, or the part of the colon. So they had to do a partial colon resection for that. There was no tumor of the appendix at that time.
and he has not had a history of any other cancer?
No.
Dr. Can you just describe what type of pain he may be in right now and what you are currently doing to that pain? What is his level of comfort currently?
He's having some pain still. We are dealing with that. We are managing that. And that's all that I can say about that, really.
Thank you very much, everybody. Thank you.
Okay, thank you. Thanks for coming.